Physiology notes of all my theory videos are available. To get your copy, you can WhatsApp on 72650 This book attempts to come up with important questions and appropriate answers in easy way. In this book, different systems are discussed under 10 sessions, and each section is framed with different topics in the form of question and answers. It provides thorough coverage of subject and made it easy to write down answers in the exams. Hello everyone, today we'll discuss about actions of glucocorticoids. Glucocorticoids, they have widespread effects in different parts of body and affecting different physiological processes. Now, these actions, they are divided into physiological actions and pathological or pharmacological actions. Now, physiological actions, they are again divided into metabolic effects and systemic effects. These effects, they are found during stressful conditions like during fasting, during exercise or any other kind of physical or mental stress. Now, let us start with metabolic effects. Effects on protein, carbohydrate, fat metabolism and on mineral and water metabolism. So, starting with protein metabolism. Glucocorticoids, they reduce cellular proteins. That is because of catabolism of labile protein or you can say reserve protein, especially in the skeletal muscle, connective tissues, that is in bones and lymphatic tissue. Because of reduction of protein stores in all the body cells except liver, that is due to increased catabolism, and second, that is decreased synthesis of protein. So first effect, that is decreased cellular proteins due to increased catabolism or decreased synthesis. And this is the reason with excess glucocorticoids there is negative nitrogen balance, and because of negative nitrogen balance there is marked muscle weakness. Protein breakdown, because of protein breakdown amino acid level increases, and these amino acids, they are taken up by the liver and they form new proteins. This amino acid transport to the extrahepatic tissue, especially muscle and lymphatic tissue, is reduced. But the transport of amino acids to liver increases. But in the liver, these amino acids are converted into glucose, and the process or the step that is known as gluconeogenesis. There is also increased rate of deamination of amino acid in the liver. Glucocorticoids, they also have anti-anabolic effects. They inhibit de novo synthesis of protein by affecting at translation level. Second effect on the carbohydrate metabolism, glucocorticoids, they increase blood sugar level, and the mechanisms are: number one, they increase gluconeogenesis by increasing formation of the enzymes glucose 6-phosphatase, which is required for gluconeogenesis in the liver. Also increases catabolic effects on the muscle protein and inhibit protein synthesis. So what happens? Amino acid level increases and these amino acids are converted into glucose. Also glucocorticoids, they increase lipolysis, and this glycerol, that is provided for gluconeogenesis. So first step, that is it increases gluconeogenesis. Second, that is it increases glycogen synthesis. You can see here glycogen synthesis is increased by increasing the enzyme glycogen synthetase, and indirectly it inhibits glycolysis in the liver. So glycogen synthesis is increased. Third effect, that is it increases absorption of glucose from digestive tract, and thus blood sugar level increases. And fourth effect, that it decreases utilization of glucose by peripheral cells, because it decreases the uptake of glucose by muscle, skin, connective tissue, bones and adipose tissue, and decreases oxidation of NADH that is required for the glycolysis. So glycolysis utilization of glucose is reduced, and thus blood sugar level is increased. And this is the reason glucocorticoids, they should not be given in the patients with diabetes mellitus, or they should be given with caution. Clinical physiology here, that is adrenal diabetes. Here blood sugar level increases, that is because of increased secretion of glucocorticoids. What are the causes? As we have discussed, glucocorticoids, they increase gluconeogenesis, they decrease glucose utilization by cell, and they increase glucose absorption, and therefore blood sugar level increases. Because of this, insulin secretion is increased, but With high glucocorticoid level, the sensitivity of many tissues, mainly skeletal muscle and adipose tissue, to this stimulatory effect of the insulin is reduced, and that condition is known as insulin resistance or decreased insulin sensitivity, and that results in increase in the blood sugar level. Means in spite of increase in the insulin, our blood sugar cannot be controlled, and this is adrenal diabetes. What are the effects on fat metabolism? Glucocorticoids, they increase mobilization of fatty acid from adipose tissue and redistribution of fat. How? These glucocorticoids, they inhibit fatty acid synthesis in the liver but not in the adipose tissue. So here what happens, they increase oxidation of fatty acids in the cell, and when fatty acids are oxidized, there is increase in the formation of free fatty acids in the plasma, and these free fatty acids are used for energy. Therefore you can say fatty acid concentration in the plasma increases and these fatty acids are utilized. Okay. Now this increased fatty acids, they are used for metabolic energy, and you can see here that because fatty acids are used for the metabolism, now our metabolism shifts from glucose to fat. So the metabolic system in the cell shifts from glucose to fat. So you can say here that is fatty acids are mobilized from adipose tissue and redistributed. It has also lipolytic action. Glucocorticoids, they increase lipase activity. Lipase activity by potentiating, or you can say permissive action of epinephrine, norepinephrine, growth hormone, glucagon and thyroid hormone. All these hormones, they increase lipolytic activity by increasing lipase, and this effect is increased by glucocorticoid. So you can say that it indirectly stimulates lipolysis. Third, that is ketogenetic effect, means increase oxidation of fatty acids, and that produces ketone bodies, and the condition gets worse in diabetes. In healthy individual this won't happen. Why? Because when blood sugar level increases, insulin secretion increases, and insulin decreases ketone body formation. Then another effect is it increases blood cholesterol level. Because of lipolytic effect, blood cholesterol level increases, and also it has lipogenic role, means it, as we have discussed, it causes redistribution of fat. Lipolytic effect in some of the adipose tissue and lipogenetic role in some other adipose tissue. So it results in redistribution of fat. So lipolysis and deposition of fat in peculiar type, and this is buffalo torso or moon face or central obesity, means here fat is deposited in the central part of the body with thin extremity. Exact mechanism for this is not known, but maybe because of stimulation of food intake and generation of fat in some tissues of the body. This is more rapidly than it is metabolized and oxidized. Now, effects on mineral metabolism. Here, glucocorticoids, they have mild mineralocorticoid-like activity, and that causes sodium and water retention and potassium excretion. Also, it increases angiotensinogen synthesis, and that plays an important role in renin, angiotensin, aldosterone secretion. So it increases aldosterone secretion also. Another effect is it increases inactivation of antidiuretic hormone by liver, and it antagonizing the action of ADH. What is the action of ADH? That is antidiuresis, means formation of concentrated urine. So when glucocorticoids are reduced, there is dilute urine because the antidiuretic effect is lost. Applied aspect here, that is in adrenal insufficiency. There is glucose fever, means in the patients with adrenocortical insufficiency, if we are infusing glucose, because of the infusion of glucose, there is high fever. Along with that, the patient is having convulsions, unconsciousness, coma, collapse and death. What is the reason here? Because of infusion of glucose, there is retention of glucose and water, as we have discussed. Because of deficiency of glucocorticoids, there is deficient diuretic response. So there is no diuresis, means water is retained. And because of retention of water, there is dilution of plasma, and that produces water intoxication and swelling of thermoregulatory cells which are present in the hypothalamus, and that produces fever, and which is followed by other consequences: convulsions, unconsciousness, coma, collapse and death. So we discussed metabolic effects. Now, effect of glucocorticoids on various systems, starting with the nervous system. When there is lack of cortisol, there is hypersensitivity to taste and smell sensation. Along with that, we can find slowing of alpha waves in EEG, and there are personality changes like irritability, insomnia, apprehension, inability to concentrate, and the person is having mental fatigue. When there is excess of glucocorticoids, there is decreased threshold for the excitability of brain. And therefore, you can say when the threshold decreases, excitability increases. And as the excitability increases, it produces convulsion, coma, and epilepsy. So, this glucocorticoids, they can be given with caution in the patients with epilepsy. Sometimes, because of increase in excitability, it may produce euphoria, that is a false sense of well-being. Other effect of excess glucocorticoids is it decreases memory. Actions on cardiovascular system. On the heart, glucocorticoids, they increase myocardial performance. It increases the vasopressor effect of catecholamines and angiotensin II. Decreasing production of vasodilator prostaglandins. So vasodilator effect is reduced. Decrease vascular permeability. And thus it maintains normal blood volume. Also it increases sodium potassium ATPase action and increases beta adrenergic receptors. Now, effects on the blood vessel. Glucocorticoids, they maintain normal blood pressure by restoring vascular reactivity. Glucocorticoids, they sensitize arterioles to the constrictor action of catecholamines. So it has permissive action. Catecholamines, they can work in the presence of glucocorticoids. Plus, glucocorticoids, they inhibit catechol O-methyl transferase, which is required for the degradation of catecholamines. So catecholamines are not degraded, and the synthesis of catecholamine is also increased by glucocorticoids, because the enzyme PNMT, phenyl N-methyl transferase, that is activated by glucocorticoids. So, in absence of glucocorticoid, the circulating catecholamines, they cannot produce this effects on the blood vessels, and that results in vasodilatation and increased capillary permeability, and that results in collapse and death of the individual. Effects of glucocorticoids on muscle. Glucocorticoids, they are required for skeletal and cardiac muscle contraction as well as work performance. So when they are excess, muscle mass and strength both are reduced, and that may produce muscle weakness and myopathy because it has protein catabolic effects. So normal glucocorticoids, they improve the performance of cardiac and skeletal muscle, but when they are in excess, they produce negative nitrogen balance, and that results in muscle weakness and myopathy. Effects on bones. Normal glucocorticoid level is also required for homeostasis in the bone. So when glucocorticoids, they are increased, bone resorption is increased because they increase osteoclast, and they also increase collagenase enzyme that produces resorption of bone. Second effect, that they decrease bone formation because they inhibit development of cartilage, and because of decreased development of cartilage, there is thinning of epiphyseal plate, and therefore new bone formation is reduced. Also, they inhibit the formation of osteoblast. Also, they increase apoptosis of osteoblast and osteocytes, and they decrease calcium deposition. Another effect is they cause protein catabolism, and it causes breakdown of bone matrix. Also, they increase calcium excretion in the urine, and they decrease calcium absorption from digestive tract because they inhibit the action of 1,25-dihydroxycholecalciferol on the digestive tract. And because of all these changes, there is osteoporosis, which produces skeletal deformity, as well as because of decrease in the serum calcium level that develops clinical sign, that is tetany. Effects of glucocorticoids on blood and blood cells. Excess glucocorticoid produces eosinopenia and basopenia, means decrease in the eosinophil and basophil count due to increased sequestration of eosinophils mainly in the lungs and spleen, and increases eosinophil destruction. Changes in the eosinophil count, it is an important index of ACTH secretion. So ACTH secretion increases, eosinophil count decreases. Then lymphopenia, means lymphocyte count decreases. That is because of decreased proliferation and increased destruction of lymphocytes. Mainly, what is the reason for decreased proliferation? Because it interferes with the DNA synthesis and decrease the mitotic activity of the lymphocyte. They also decrease secretion of cytokine, that is interleukin 2, that results in decreased proliferation of lymphocytes. And These cells, they undergo apoptosis, so that is lymphopenia. Third effect also produces polycythemia because it stimulates erythropoiesis, thrombocytosis, increase in the thrombocyte count. Effects on the connective tissue. Glucocorticoids, they decrease collagen synthesis. Skin thickness is reduced, and there is thinning of the capillary wall, which results in the rupture of the capillary wall and produces intracutaneous hemorrhages. Effects on kidney, it increases GFR and it has diuretic response, so it causes excretion of water load. Effects on the digestive system, it increases secretion of gastric acid and pepsin, and it decreases the proliferation of gastric mucosal cell. So when they are used for a long period of time, because of decreased proliferation of mucosal cell and increased secretion of gastric acid and pepsin, that may lead to peptic ulcer. Also, it increases fat absorption from intestine into the lymph. Next is permissive action. What is permissive action? That is presence of minimum level of the glucocorticoid that is required for full-blown effect of other hormones. That is permissive action. These glucocorticoids, they are required for calorigenic effect of glucagon and catecholamines, and lipolytic, glycogenolytic, vasoconstrictor and bronchodilator effects of catecholamines. So this is all about physiological effects. Let us discuss, as we have discussed, first that is metabolic effect, effects on the carbohydrate, fat, protein metabolism, mineral and water metabolism, and then effect on the nervous system, effect on the cardiovascular system, effects on the muscle, bone, effects on the blood, effects on the connective tissue, effects on the kidney, digestive system, and permissive action. Now, next is pharmacological effects, or effects they occur at the pharmacological doses. First, that is anti-inflammatory effect. Now, what is inflammation? Inflammation means body's response to injury, whether it is biological injury or physical injury or any kind of other injury. Our body responds to this injury in the form of inflammation by giving vascular and cellular response. Now, there are 5 cardinal signs of inflammation, that is redness, heat, or you can say temperature, swelling, that is edema, pain, and 5th one, that is loss of function. Now, what is the mechanism of this inflammation? Inflammation is because of release of chemicals which activate inflammatory process. These chemicals, they are released from various WBCs, and they are mainly histamine, bradykinin, proteolytic enzymes, prostaglandins, and leukotriene, and they are responsible for vasodilatation, erythema, and edema. So that is the first step, that is release of mediator. And second step, that is because of this mediator there is vasodilatation, and because of vasodilatation blood flow increases, that produces redness. Third, because of this inflammatory mediator there is leakage of plasma. Plasma leaks out and increase in the capillary permeability, that is the cause for leakage of plasma, and capillary permeability increases because of this mediators, and because of that produces edema. Third step, that is infiltration of leukocytes. Leukocytes, they move at the site of injury. And last one, that is there is fibrosis and healing, that is after days or weeks. So this is the process of inflammation. Now, what is the role of glucocorticoids to prevent inflammation? First and foremost step, that is it stabilizes the membrane of lysosome. So from lysosome, various granules, they cannot be released, and various proteolytic and hydrolytic enzymes, they are not released in the tissue fluid. So damage to the neighboring tissue is reduced. This is first step. Second step, that is it decreases permeability of capillaries. Capillary permeability is reduced, so erythema and exudation of fluid and edema is reduced. This is secondary effect of decreased release of proteolytic enzymes from the lysosome. Third, it decreases the migration and infiltration of WBC at the site of injury. So phagocytic effect and formation of prostaglandin and leukotriene is reduced, so decrease in the temperature. T lymphocytes and antibodies production also reduced, and it also further decreases inflammatory process. Other effects are it decreases release of interleukin 1 from WBC. So temperature is reduced, and along with decrease in the fever, there is decreased vasodilatation. So exudation of fluid is also reduced. Also, they decrease collagen synthesis and they inhibit phospholipase A2 synthesis. So you can say after inflammation has begun, it can reduce the inflammation by blocking most of the factors that promote inflammation. It also increases rate of fibrosis and healing because it mobilizes amino acid for the repair. Also, it increases fatty acid and glucose, which is required for energy at the site of injury inflammation, and also increases resistance to physical stress. So you can say glucocorticoids, they are like asbestos suits against fire. Means they protect tissue from the damaging effect of inflammation, but they cannot treat the cause of the disease. Therefore, in cases of infection, these glucocorticoids, they are always given with antibiotic so that we can also prevent the spread of infection. Now, clinical significance. Glucocorticoids, they decrease fibroblastic activity, which results in delaying wound healing. Also, they decrease production of ground substance by collagen and collagen producing cell, and thus it prevents adhesion, and they are given after abdominal surgery to prevent adhesion. Also, they decrease release of endogenous pyrogen and decreases fever. They also have destructive effect on the fixed lymphoid tissue, and therefore antibody production is reduced. Also, they decreases the degrading effects of collagenase on the joint tissue, mainly in the rheumatoid arthritis, and therefore glucocorticoids, they are injected intra-articularly in cases of rheumatoid arthritis. Role of glucocorticoid in allergic reaction. Glucocorticoids, they do not affect basic antigen-antibody reaction that occurs in allergy, but it affects or it blocks the inflammatory response because of the allergic reaction. How? They decrease number of circulating basophils, as we have discussed. Glucocorticoids, they produce basopenia. They also decrease number of basophils and protect release of secretory granules by granulocytes, mast cells, macrophages, and decrease release of serotonin, histamine, and hydrolase at the site of inflammation. Also, they decrease synthesis of histamine inside the cell, and they also inhibit hypersensitivity to antigen-antibody reaction, and therefore they are used in cases of severe allergic reaction, like in severe bronchial asthma, which may be life-threatening, that is asthmatic attack, or in cases of anaphylactic shock, which may lead to death. So in those cases, these glucocorticoids are life-saving drugs. Effects of glucocorticoids on immune system, that is immunosuppression. That is because of decrease in the eosinophil and lymphocyte count, and atrophy of lymphoid tissue, that is because of decrease in the interleukin production and decreased proliferation of lymphocytes. And this immunosuppression, they have positive and negative effect. Positive effect is we can give glucocorticoid for immunosuppression after transplantation of tissue, so that this rejection reaction is reduced, and also it is useful in the treatment of lymphatic leukemia. But negative effects are if they are given in immunocompromised subject, or if they are given in, at the time of infection, there is fulminating infection, and that results in death of the individual. Clinical physiology, synthetic cortisone and cortisol, which are known as prednisone and prednisolone, they have 5 times anti-inflammatory potency than the parent compound without any increase in the mineralocorticoid activity. So they are given in the bacterial infection with antibiotics, that is to prevent complication due to immunosuppressive effects of glucocorticoids. Role in the fetal life. Glucocorticoids, they facilitate maturation of CNS, retina, and skin in utero. Also, they are important for the maturation of lungs because glucocorticoids, they stimulate production of surfactant associated protein and also increases phospholipid synthesis by enhancing the activity of phosphatidylcholine. So these phospholipids and proteins are important components of surfactant. So surfactant secretion is increased, and this surfactant decreases the surface tension, and therefore it decreases respiratory distress syndrome in newborn baby. Also, they are important for the maturation of gut. Cortisol changes intestinal mucosal enzymes from fetal pattern to the adult pattern. So they are also important in such way. So this is all about actions of glucocorticoids. Thank you.